For some reason I got this in my head. Sorry I'm making everyone go to so much effort. I got this in my head of you talking about the concept just because it's so stuck out for me. Although Leslie is not a scientist, she is passionate about physics because it has transformed the way she practices aesthetic medicine.
And you can see actually there's a whole bunch of land right on this side that could technically support this bridge, or you have the struts or the beams that are also supporting the bridge. So you can do it either way, you just get less product, and I think a very much prettier look with the beams versus the solid structure underneath.
Core physics principles helped Leslie explain how she was achieving incredible results with her new injectable thread lift technique. Injectable thread lift is a procedure which uses an arching technique to administer dermal fillers to the aging face. The arching technique and the entire injectable thread lift procedure were developed by Leslie for her patients. Dr. Michael NEWMAN, who has watched Leslie develop and refine the injectable thread lift technique, says her method not only fills folds and lines, it lifts the entire face.
There are two things. One is that you get more support for the tissue, that the tissue kind of looks more rejuvenated afterwards. When we're talking about tissue, we're talking about usually wrinkles and folds of the skin, and so by putting this product in a certain way, using the injectable thread lift, it really supports the tissue more and rejuvenates more. And then the other thing is that it lasts longer, and one of the theories as to why that might be is because it causes some tissue to remold or reshape under the skin just from the placement of the needle and the direction of the needle. And so potentially a longer lasting result.
Leslie developed this new technique because she was dissatisfied with the results traditional methods produced.
So with traditional fillers, what I had been doing for the previous 6 to 7 years before I developed this technique was to go in parallel to the shadow or the fold that I was trying to eliminate and put product or the fillers here to take away the cast of the shadow. Sometimes it looked okay, other times it didn't look okay because the valley was so deep that you had to put so much product, and then it looked like they had a little sausage on either side of their mouth. And then when they would smile, it would pop forward and even be more prominent. So I had to sort of think outside the box and think of how other ways that I could do it. And we had talked and had been doing cheeks before, and that helps take some of the pressure of the mound of skin off of the fold by putting volume in here. So with that in the back of my mind, thinking, just taking it the next step of how I can take pressure of this off of here, I went across it and tried to pull it back as I was coming out, and then just over time developed more of this arcing technique. See that there's structural beams strategically placed in 4 corners holding up the strength of that bridge. If you think about the reason why, you can fill this up and just kind of prop it this way with a lot of product, or you can put strategic posts. And it's the same thing with like a freeway overpass. You can support that freeway with a cinder block wall or 3 or 4 strategic posts. Either way, it's getting supported, but with the posts, you're using much less product.
Because the delivery method of this non-surgical technique is so unique, the results are more natural than surgery or traditional ways of addressing aging. One of Leslie's colleagues became a devoted convert to injectable thread lifting and trained with Leslie. She liked the results so much, she decided to have Leslie soften the smile lines and fine wrinkles on her own face.
Right. You know, it's not fair to say you don't have to work at looking pretty, because that gives that expectation for all women later that, well, why don't I look that good, and you know, and that's just not fair.
The nasolabial folds is a good way to start. For example, the smile lines, we all learn to do medial to the line, which is this way, and never laterally. So when I first came across Leslie's articles, I was shocked, because it's just like if you say, let's start building a house from the top to the bottom rather than the bottom to the top. And so when I first saw the way it's done, in which you lift the skin, so you start laterally to the fold as opposed to medially, not only did it fill the face, but also it redirected the skin. So with the conventional manner that we use to look at the face, we were just able to fill the line, but not redirect. And if you look even at children, they do have the lines or the folds, but the cheeks and the skin are lifted, and that's the big difference. So the benefit is not only do you use less product, but the results are dramatic.
When we come back, we'll show you why this innovative procedure is a good fit for the average woman who wants a little lift in her life.
Signs of aging that women get in this age group.
Susan is the principal of the school Leslie's son attends. She's an active woman in her early 60s who has never had any plastic surgery or cosmetic procedure. Leslie says Susan is a great example of her average client, a woman who just wants to enhance her natural beauty without doing anything too dramatic.
She's got the most beautiful blue eyes.
It was important to Susan and her family that the results be natural and subtle.
He was very, very worried about it. He did not like it when I brought it up. He thought that it was, in his eyes, unnecessary. But I told him that I really wanted to do it and that it would be okay. And he was quite nervous and came here to make sure that he recognized me on the way out, and he's been very, very pleased that it was so subtle.
Comparatively to surgery, like the principal we saw this morning went out to dinner that night and went to school and did her activities the next day, had a parent meeting that night. That's impossible with surgery. First of all, you're in the hospital. Secondly, you're unrecognizable. Your face is very, very swollen for many, many months.
Doctors say injectable thread lift provides their patients with a number of benefits.
The new technique seems to make them happier in that I can get the same results, but I use smaller volumes of filler product, which of course means we can charge the patient a little bit less. Patients who've had it both ways definitely seem to prefer Leslie's technique.
I think it lasts longer because it causes some scar tissue under the skin, and scar tissue actually creates support and holds tissues in its place. So if you put scar tissue in the right place, it can actually help. And so scar tissue, I think, is what allows it to last longer. By passing the needle through the skin, it breaks some of the collagen fibers and causes new collagen to form in its place. And that collagen can support the tissue.
Doctors say fillers are starting to replace the role surgery once played.
Really the trend, historically, facelifts were a big part of plastic surgery, and since so many of these wonderful fillers and wonderful techniques have been around, really facelifts have become less and less common, and it's probably going to continue to trend that way, just because there are so many other ways to rejuvenate the face without having to make these big incisions and end up with big scars.
And I think that is the mentality of most women, that they want to go completely with a non-surgical approach and to do it little by little instead of one day waking up and going, now what do I have to do? I haven't done anything for the past 25 years, 30 years, and I'm waking up surprised that I have all of this laxity and overhangs, and then now we're at 5, 6, 7 syringes. When you start when you're younger, which is doable. We could still do that. We don't write them off. But when you start when you're younger, you're basically, again, stimulating that collagen every time you put the needle in. And it prevents the need for so many syringes to be used over time. So it is great. And my ultimate goal with any client, no matter how old or young they are, is to give them the best, most aesthetically pleasing look for them and to highlight their best features.
With pioneers like Leslie, advances in aesthetic medicine are sure to continue to transform the realm of possibilities for patients.
Leslie, like I told her before, I think if I had to describe her, I think she's a trailblazer. I think she's opening the doors for all of us because she's such an innovator. She has great vision and creativity, and she's really strengthening the nursing presence, in the medical world. And I think that's so important, not only for the recognition for nurses, but also as a provider. It gives you, also the idea, I can do it too. It's possible.